it's referenced several times under the President's Affordable Care Act, under Subtitle E, Medicare, Medicaid, CHIP program integrity provisions. Several provisions that were signed into law by the President. Maybe we can just briefly run through those, and you can tell me if those have been implemented. The face-to-face encounter with a patient that's required before a physician may certify eligibility for durable medical equipment.
I believe that one has been implemented, but
so that's a yes.
I believe
ding, ding, ding. Yes. Good for you. Implement criminal background checks for fingerprinting for providers and suppliers considered at risk.
We have not finished the implementation of that for a number of reasons, in part related to the FBI's own internal re-awarding of its contracts, but we are in the process, very much in the process of putting that into place, sir.
It's been almost 3 years since this was signed into law. It's important stuff. I get the FBI and the Justice Department engaged because it was felt to be important by the President. He signed it into law. Let's see that it's implemented. How about implementing limitations on how much high-risk providers and suppliers can bill the Medicare program within the first year?
We are in the process of developing the.
So that's an incomplete. How about implementing a temporary moratorium for new Medicare providers from enrolling and billing the Medicare program, even though there are more than enough suppliers to furnish health care services in certain areas of the country?
That's a very important tool. We've been looking very carefully at the places to implement it, and we are in the process of moving forward with that. Where we think it's appropriate as an adjunct to all of the other tools.
Well, important tool, but it's
we have not implemented a moratorium yet. Is the straight answer.
It's languishing, and we're coming up on 3 years. Establish a compliance program for fee-for-service providers and suppliers.
We are still in the process of working on that, in part because the Inspector General has long since had very sound guidance for providers for voluntary compliance programs. And
okay, I'm running out of time.
Build on that.
That's also an incomplete. Implement a surety bond on home health agencies and certain other providers of services and supplies.
The surety bond program is in place for DME, but we're still in the process of implementing it beyond that.
For home health specifically, that's a no. And then what about implementing checks to make sure that a physician actually referred a Medicare beneficiary for medical service before paying the claim?
We do have processes in place that are doing that.
Incomplete. So 1 out of those 7 things that were signed into law by the President that are always referenced as, hey, these are important things that we want the Affordable Care Act to do to combat fraud, we're still waiting to see if they, in fact, will be effective. But thank you, Mr. Chairman. You've been generous. I'll yield back.